There is laser therapy, as a newer treatment, and then regenerative injections as well. Now, this is exactly what I was just talking about. Unicompartmental arthritis. This is very common. Just the inside of the knee starts to wear. That oftentimes is caused by an injury to the meniscus, in some cases by chronic foot or hip problems. But that increased pressure on the inside of the knee creates advanced degenerative changes just here. Even though the outside portion of the knee really is preserved pretty well, this guy starts to wear and he ends up looking pretty rough just on that inside part. That's when you'll see somebody walks this way. They'll typically have quite a bit of pain with that, because it's arthritis, it's just focused on one area. Now, bracing supports the knee, and this is outside bracing. It's called an offloading brace, and it can actually correct some of this angulation and open up the inside of that knee joint space to correct that overcompensating, that kind of bow-legged approach. If you can do that, then in many cases you give that knee a great, much needed break. You can still function, you can still do things without having the pain, the inflammation, and so forth. And it can work quite well. They are kind of a pain because you got to strap them on outside the pants. You got to have pants that are loose enough, and you got to put it on anytime you're going to be on your feet for a while. But they do work very well. And the research shows that they're a very cost-effective way to manage something like that, rather than going straight to like a partial knee replacement, where they can just replace, say, 1/2 of the knee. But even in this article, they make the point of saying, look, this, a brace can't be just a standalone treatment. You just can't slap braces on the knees and think, okay, I'm good to go now. There needs to be additional treatment along with that. One thing we can talk about now is laser therapy for the knee. And specifically, laser therapy is a safe and non-invasive infrared light. What it does when it's absorbed by the tissues of the body is it's transformed from a light energy, photons, into chemical energy. It selectively targets damaged tissues, and it allows more oxygen to go from blood flow into the cells, and it speeds up the cellular metabolism. And it's kind of like getting a little campfire going and then getting down and blowing on it. It just accelerates that process. You're speeding up that process. Laser therapy essentially can just speed up the rate at which the body repairs or heals. Again, very, very safe. We're not talking about burning or cutting any tissues in this case. And we've got a lot of research on the knee in particular for laser therapy. Again, be happy to give you some of these references. But we've got over 4,000 studies have been done on laser therapy, stating that it is perfectly safe, there's no side effects, it's not addictive like medications can be, and it works very well when we talk about knee arthritis in particular. Works well with physical therapy, works well with meniscus tears, and I'm not going to go through all these. Like I said, if you guys want these, I'm happy to send this over to you. But considered an effective non-surgical intervention for reducing pain in patients with arthritis, helping them perform daily activities. That's the point, right? If you've got arthritis, if you've got some of these things, it's not just about trying to reverse the arthritis. It's about feeling better, being able to do more things, function.
What is gun arthritis?
Gun arthritis is just the fancy word we use for knee arthritis. Gonalgia, knee pain, I don't know, Latin, whatever.
So are you saying there's not really any negative side effects? It just either helps or doesn't help?
That's exactly right. That's what we've seen in over 50 years of research. It does not work every time for everyone. Nothing does, right? I mean, there's nothing that's 100% successful across the board for every single person. But the results are incredibly high for something that is non-invasive, is cheap, and doesn't have any side effects. So it's become more and more of something that people look at. Just here in the Valley, since we started up, we were the first laser providers here in the Valley, but that was about 6 years ago, somewhere around there. In that time period, we've had about 10 other people start picking up and using laser therapy, because it does work very well. And the machines at this point, the lasers themselves, have come along far enough in technology that they're making a great difference.